Hello, my name is Carolina Schinke. I'm one of the faculty members at the University of Arkansas for medical sciences and work primarily in multiple myeloma. So I'm very excited to be here and also at ASH and present our work on ICAHT, which is cytopenias, immune-associated cytopenias in patients who undergo immune treatment, particularly CAR T-cell treatment. And our work is more not just evaluating these patients, but also looking what can be done to mitigate these cytopenias. So what we have done in the past is to give them a stem cell boost, which is infuse them stem cells, similarly to how we do after stem cell transplant. Obviously, we don't give the chemo, so there's really no side effect to it. It's just the stem cells that are being infused. And this is part of the work we're going to present here. So first of all, this ICAHT stands for cytokine-associated, conferred by these immune treatments on the cell count. So a lot of patients will have cytopenias after CAR T-cell treatment. And sometimes this cytopenia is actually very severe. It's so severe that patients have to come in weekly for growth factor shots or for transfusions. And so though the myeloma is gone, or hopefully in remission, the patients are still experiencing quite a lot of morbidity due to a lot of visits and sometimes side effects from low blood counts, which are infections, bleeding, or requirements of transfusions. First of all, we looked at how often that happens. We see that early on, within 21 days after CAR T-cell infusion, we see it in 60% of patients. And again, that was done in our patient population. This is all off trial. This is what we've seen in real world data. And we did that in collaboration with another university, Medical College of Wisconsin. Overall 159 patients. And 89 of those, so almost 60% of patients, developed cytopenias 21 days after CAR T. Over time, these cytopenias can improve, but we see that in 17% of patients, they're still persisting up until 6 months. So this is really a long time frame where we have patients coming in with clinically significant cytopenias. So factors that really predispose patients to develop ICAHT in our work really divided into 3 categories. First of all, it really depends how much treatment patients have before. So a lot of transplants, a lot of lines of treatment, low bone marrow reserve will predispose patients to develop cytopenias post-CAR T. So if you're receiving CAR T in very late lines, there's a good chance that you will have cytopenias after CAR T. The other thing we found is that patients who have high-risk disease by FISH or by PET scan also tend to have a little bit more cytopenias, a higher risk of ICAHT after CAR T. And then the last thing is also if patients develop severe ICANS, so neurotoxicity after CAR T, or required tocilizumab. These were all factors that promoted the development of ICAHT or cytopenias after CAR T. When we look at those patients that received a stem cell boost, not all patients with cytopenias maybe need a stem cell boost. Some will actually recover, but those that had most severe cytopenia, so really low blood counts after CAR T, where they required to come in a lot and receive transfusions, growth factors, those were given a stem cell boost by the treating physician. And what we see is that the counts recover really nicely with stem cell boost. So from 21 days after CAR T to 3 months, we had a robust, prompt, and durable count recovery, and that lasted up until 6 months. So we think that this is very effective to improve the counts, and in that way probably can also mitigate things like infections or requirement of transfusions. When we look at what are the outcomes of our patient populations that we looked at, we see 12-month progression-free survival was 67%, overall survival was 88%, so pretty much in line with what has been reported. And factors that influence outcome were really more intrinsic to myeloma disease, so high-risk myeloma, extramedullary disease. These are aggressive diseases that tend to have an adverse impact on outcome. But we did not see any adverse impact, of stem cell infusion on outcome. So we think it's very safe, and it certainly helps patients to recover counts. And we think that it might even improve outcome because patients will have better counts, less side effects due to low counts. So we're very excited about this data. And I want to encourage patients and the providers to consider having stem cells in the bank before they go to CAR T-cell treatment to treat these cytopenias if they're very severe. So these are all things we didn't really measure. It was all retrospectively, so we don't really have raw data for that. But obviously, yes, hypothetically, yes, it improves quality of life, and again, we think that it also improves, eventually can improve outcome, because what we see a lot of times when patients are very low blood counts, and then relapse over time, they cannot receive more treatment because the counts are just too low. So you really, with giving them a stem cell boost and rescuing these blood counts, it's really a win-win situation, yeah.